kidney disease and peripheral vascular disease are two major complications that are frequently encountered in type 2 diabetes patients. Regarding DKD, trusting albuminuria to identify and monitor progression of DKD may delay the diagnosis of a significant proportion of patients, as it was recently for sets of patients may develop DKD and renal insufficiency in the presence of minimal or insignificant proteinuria, a special entity known as non-albuminuric diabetic kidney disease. Moreover, not all patients with type 2 diabetes and mild or moderate albuminuria will go on to develop severely increased or overt albuminuria. And in fact, some patients may actually regress to normal albuminuria. Thus, the old concept that albuminuria is always progressive in type 2 diabetes patients is no longer tenable. Likewise, depending on the ankle brachial pressure index as the sole method for detecting cases of BVD in type 2 diabetes patients may be prone to errors. Therefore, an intense need has emerged to discover a new biomarker that can replace the old methods for diagnosing these two conditions. And in the current study, we explore the potential ability of microRNA 21 to diagnose these two conditions. Uh, Regarding the methodology, in the current study, 90 subjects were selected and divided into three main groups. Group A, which included 30 patients with type 2 diabetes and without evidence of DKD, which means they have urinary ACR less than 30. Group B included 30 type 2 diabetes patients with evidence of DKD. And lastly, Group C included 30 healthy volunteers that were matched for both age and sex as a control group. We also performed venous blood. Venous blood was drawn for measurement of fasting plasma glucose and hemoglobin A1C. And also, the insulin resistance was measured by using the HOMA-IR model. Early morning urine samples were collected for determination of urine ACR, which were also repeated after 3 months to verify chronicity of any abnormal urine result. Molecular quantification of plasma microRNA 21 was also done. And lastly, measurement of ankle brachial pressure index was performed by using a specific handheld Doppler device. Our results came as the following. The three study groups were comparable regarding age and gender, and there was a statistically significant difference regarding the duration of type 2 diabetes among the two groups of type 2 diabetes patients. The fasting plasma glucose and hemoglobin A1C were significantly higher in those with type 2 diabetes and increased urine ACR in comparison to those with a normal urine ACR. Likewise, there was a statistically significant difference between both patient groups regarding HOMA-IR. When comparing the ankle brachial pressure index between the three studied groups, it showed a statistically significant difference between groups A and C and groups B and C, but no statistically significant difference between groups A and B. Regarding the plasma expression profile of microRNA 21, it was significantly higher in type 2 diabetes patients with normal and elevated urine ACR compared to healthy controls. Furthermore, plasma microRNA 21 profiling was considerably higher in type 2 diabetes patients with evidence of DKD compared to those with type 2 diabetes and the normal urine ACR. Moreover, in type 2 diabetes patients, the plasma microRNA 21 profiling was positively correlated with diabetes duration, fasting plasma glucose, HOMA-IR, and urine ACR, but negatively correlated with ankle brachial pressure index. Additionally, the ROC curve analysis for microRNA 21 plasma profiling in type 2 diabetes patients showed that microRNA 21 had a quite good diagnostic performance for picking up cases of both DKD and BVD. Also at a cutoff value of more than 4.23, plasma microRNA 21 expression had 86.67% sensitivity and 60% specificity for predicting DKD, while at a cutoff value of more than 5.45, plasma microRNA 21 expression had 85.19% sensitivity and 75.76% specificity for detecting BVD. To conclude, in this case control study, the plasma microRNA 21 profiling levels were highly related in patients with type 2 diabetes compared to healthy controls. Also, the plasma microRNA 21 showed positive correlation with clinically significant glycemic parameters such as fasting plasma glucose, hemoglobin A1C, and HOMA-IR. Additionally, in patients with type 2 diabetes, plasma microRNA 21 profiling levels were positively correlated with urine ACR. Moreover, plasma microRNA 21 showed both diagnostic performance for detecting DKD in patients with type 2 diabetes. Furthermore, plasma profiling levels were positively correlated with the degree of BVD as represented by ankle brachial pressure index readings. Thank you.